Experts say that good mental health is vital to the overall well-being of individuals, yet 1 in 8 people globally are believed to be living with one form of mental health condition or the other, which can impact negatively on their physical health, their well-being, how they connect with others, as well as their livelihoods. Now, this is even more worrisome with the rate at which such conditions are affecting an increasing number of adolescents and young people.
Well, this year's theme, mental health, is a universal human right. The WHO is calling on member states and partners to celebrate efforts in mental health in a human rights-based approach. This morning, we're joined by Joseph Oike. He is the Director General, Kaduna State Bureau for Substance Abuse, Prevention and Treatment. Thank you so much for being here, Joseph.
Thank you for having me. Good morning.
All right, let's start off first with the theme for this year. Taking a look at our minds, our rights, and how it keys into the situation of things that's got to do with Africa, Nigerians as a whole, with mental health.
Yeah, so this year's theme of mental health as a universal right focuses on something that the WHO and I think the entire health community and mental health advocates have been talking about for a long time, which is that we need to end this dichotomy between mental and physical health. If you think about it, we tend to think about health from here up as being somewhat different from health from here down. And we're saying that if health is a universal basic right, then that includes every form of health from here all the way down. Mental health is just as much a universal basic right as physical health is. In fact, we should stop looking at physical health as being somehow different and disconnected or even less important than physical health, because we understand that mental health is just as significant. In fact, the body is one whole. So where there is an unwellness in one part of the body, it affects the entire body, and that includes mental health conditions.
All right, we'd like you to give us sort of a realistic picture of where we are as a country when it comes to conversations of concerning mental health. So where is Nigeria in the global conversation of mental health?
Well, as you can imagine, Nigeria is a developing country. And with developing countries, there are challenges when it comes to the health sector. There are also challenges, particularly when it comes to mental health, because this is an area that people don't really understand as well. There's a lot of social, cultural stigma around mental health. It's spiritual in origin. What actually causes it? Is it infectious? So for this reason, we don't really talk as much about mental health as we should in public spaces. Mental health is not readily available as much as it should. I mean, when you think about it, almost every state in Nigeria has maybe one large psychiatric hospital where people with mental health problems are shifted off to and locked away and managed there, almost like, back in the day when we used to have leper colonies for people who have leprosy, where we just send them away somewhere far away and try and pretend like they're not really part of our community. A lot of that is changing globally, and there's a drive to change that as well in Nigeria. So, for example, in Kaduna here, one of the things that the government of Kaduna, the Kaduna State government, is doing is to integrate mental health services at the primary health care level. What that means is you don't really need to wait till the case gets so bad that you need to send someone away before people can access services for mental health. And if you think about it, this is also part of this year's push with the World Mental Health Day. Accessibility at the community level for mental health issues. We believe that when people get to experience mental health issues being treated in their communities, people get mentally unwell and mentally stable in their communities, it would have a direct impact on the stigma, because you get to see that someone can get ill and get well. The same way they have malaria, they get ill and they get well. So the situation in Nigeria is that things are moving slowly. It is a developing country after. Um, we need to do a lot more when it comes to accessibility to mental health services, particularly at the community level.
All right. I mean, I think it's important to mention, like, I'm really glad that Kaduna State government is doing that, incorporating it into primary health care. I think that another suggestion would be that we start to see it. I don't know if you can share with us if the insurance plans also cover mental health. And you've also shared with us some of the stigma. Let's talk about, we'll come back to some of the stigma. We'll go in depth into that. But I would like us to talk about, some of the ways in which we can make mental health accessible, mental health services. One is what Kaduna State government is doing, and I'm hoping that the rest of the country can pick up with that. Talk to us about the availability of mental health services under insurance health schemes, and what other ways can we incorporate mental health and make it accessible to the common man?
You're absolutely right. Mental health schemes should be available on all insurance health schemes. And again, if you think about it, health is health. We really need to end this dichotomy between mental and physical health. Health is health. And so if you have a health insurance coverage, it should cover every aspect of your body. Yes, some may argue that insurance premiums are higher on chronic illnesses as less so when they're dealing with non-chronic illnesses. We can have those arguments at a later time. The important thing is that all health insurance schemes should cover mental health services, and yes, that makes it a lot more accessible for people in general. Having it available at the community and at the secondary level is also something that would really, really help out when it comes to access to mental health services. Presently, one of the things that we need to keep in mind is that most of the neuropsychiatric hospitals that are available are federal. These are tertiary referral sites, so they're like teaching hospitals. They're like federal teaching hospitals. What that means is if you think about a state where there's a federal institution, that federal institution typically doesn't cater only to that state. It caters to states around it. And so if you think about availability, so let me use Kaduna, for example. We have a federal neuropsychiatric hospital here in Kaduna, an excellent hospital for managing issues of mental illness. But this hospital, or rather that hospital, caters to an 8-state catchment area. So that's a population of about 30 million people. So we have about 30 million people being referred to this one health center. As you can imagine, the health center will be overwhelmed, bed space availability and all of that would be a problem. So one of the other things we need to do is to decentralize mental health services and ensure that at every level of the healthcare system, the primary, the secondary, the tertiary, there are options that are affordable and accessible to the general population.
That's a whole lot in breaking it down, but let's also look at what's really common. I think let's break it down a bit. Some far north areas or northern areas, you do have people who once in a while, because of getting depressed because of the situation around them, they engage in drugs and so on. I want us to look at drugs and its impact on mental health, especially being a mental health day. What has been the recent research, especially from your end, and how has this impacted a lot, especially on youths?
Well, there's no doubt that there's a strong association between drug use and mental illness. And I say association because oftentimes we mistakenly say that drug use or drug abuse causes mental illness. That hasn't really been proven to be the case. What we rather know is that in some instances, when people have a mental health condition, they're more likely to use drugs. And unfortunately, when they use drugs, it also makes their mental health condition a lot worse. It seems to be like a vicious cycle where these two things are connected. But this is not unusual because both conditions affect the same organ that is ill, which is the brain. Now, when we think about the fact that about 1 in 4 people have some sort of mood or anxiety disorder. It's a very common thing. And you think about what kinds of skills, particularly young people, have to cope with maybe an anxiety disorder or a mood disorder. You would understand that this leaves such populations vulnerable to unhealthy coping styles. So I'll give you an example where a young man feels anxiety to socialize. He doesn't really know how to talk to people, make friends, and things like that. Um, and then someone gives him something and says, "Here, take this. Will give you courage. This will give you confidence. This will make you a bit more open to making friends and things like that." And so he takes the drugs and he finds that this is in fact true. I feel a lot more confident. I feel a lot more this. But over time, they become dependent on that, socialized, so to speak. And in the absence of the drugs, the anxiety is a lot worse. So they have to keep taking unto a point where, their brain becomes dependent on this substance. So it is not necessarily a one causes the other situation. We know these two issues are closely related. And so part of any comprehensive mental health strategy must include strategies that address drug abuse in a preventive way. And what that means is prevention science for drug abuse is a whole new field. There's evidence about what works and what doesn't work. We need to start to look at, again, I keep stressing, the whole person. When we talk about the numbers in Nigeria, in 2018, the UNODC organized the country survey on drug abuse and found that close to about 15% of people in Nigeria have used drugs at one point or used drugs in the year before. That's a 15% prevalence rate. You think about it, you say, well, 15% is not that much. It doesn't count for. When you think about the fact that the global prevalence is 5%, it means that Nigeria is at about 3 times the global prevalence. You mentioned something about the North, and that same survey showed that, in fact, the title or the award for high substance abuse would actually go to the Southwest and South, less so the North. This doesn't mean the numbers aren't high in the North. Here in Kaduna, it's about 10%. That is still two times the global average. That's a rather high number. But the point is, it is not, these issues are not localized to any particular part of the country. However, the particular substances being used, the nature of use, and what some of the social cultural drivers in each of the areas of the country are remarkably different.
All right. There's a demographic there. I mean, we've touched on them. Adolescents, young people. I recently had a conversation with a mental health expert who said to me that it's as if we're sitting on a ticking time bomb, because there are a number of young people, even the elite, that are being exposed to hard drugs. What are the telltale signs that parents should look out for when they want to see, when they need to observe their kids who maybe might have been abusing drugs?
In general, what I say to people is when you notice that someone's behavior is changed or is different from what it is that it normally would be, that's a good time to have a conversation with the person. Now, these are two important things. First, their behavior has changed from what it normally would be. This means that you need to be, and I say this to parents all the time, the point at which there is a problem is not when you initiate a relationship with the child. There needs to be a pre-existing relationship that allows you to even be able to effectively identify that there is a problem. So if as a parent, a guardian, a loved one, you have a good relationship with this person, you would notice that things have changed. They're not doing as well as they used to do in school. They are isolating themselves. They seem to have changed their group of friends. They are poor in keeping up with commitments. So this is a kid that when he says, I'll be back at 2, he's back at 2. When he says, I'm going to George's place, and you check, he's at George's place. Now, when he says he'll be back at 2, you don't see him till 4. The excuses don't really make sense. Where he says he's going, he's not really there. These changes in behavior that are not attributable to any other factor may be an indication that it is time to sit down and have an honest conversation about what is really going on. I should also point out that this survey by the UNODC also shows that we may not necessarily be correct if we are saying that this time bomb only affects the adolescent. In Nigeria, we're seeing that this also affects people of working age, people of 35 and above. So yes, we are sitting on a time bomb if nothing is done. It is not a bomb that is localized to just young people. We're looking more at something that affects people of their productive ages, not just in the adolescent stage, even at a time where people should be at work and caring for their families. And we've also noticed that unlike most other places where we would say, okay, this is something that affects boys and it's guys being guys, a lot more women are affected by issues related to drug abuse. Similarly, with mental health. In Nigeria, that number is somewhere between 1 in 3 or 1 in 4 people who use drugs is a woman. So it's generally something that is growing in scope and in size, and it's affecting a lot more of the populations that we need for a healthy, productive community.
Well, I could say that this conversation will not stop here. We'll continue to have this conversation, especially for the whole of today and, of course, the days to follow. Thank you so much, Joseph Oike, Director General, Kaduna State Bureau for Substance Abuse Prevention and Treatment. Thank you for joining us on Breakfast Central.
Thank you very much for having me.
All right.